You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, buttock surgery, has become very popular here in America and throughout the world, as a matter of fact. And today we have an expert on the topic, double board certified plastic surgeon, Dr. Mofid. Dr. Mofid, welcome to the program.
Thank you.
Now, for people that don't know you, you're in San Diego. Tell us a little bit about your practice. Who's your typical patient?
Well, patients come from a wide spectrum of places, as you probably know. The facial rejuvenation patients are primarily those patients that are in their, say, mid to late 40s through their 70s. They really want to look better at the later stages of life to stay competitive. People who are more interested in the mommy makeover phase are typically patients in their 30s and 40s. We also have a large number of patients that are in their 20s and 30s that are interested in things like gluteal augmentation, which we're talking about today.
Okay, gluteal augmentation.
Exactly.
How popular is this, by the way?
You know,
are there any numbers on this nationwide?
There actually have been some statistical studies that have been done looking at the numbers of procedures that we've done in the United States and how that trend has changed over the course of the last decade. Now, the birthplace of this procedure is really South America, Brazil.
Okay.
And it is a more common procedure in parts of South America than even breast augmentation, for example. In the United States, we had procedures recorded of about somewhere between 500 to 1,000 procedures per year around 5 or 6 years ago. Today it's about 10 to 20,000 procedures per year, depending on whether we're talking about implants or fat, which is used for the augmentation.
And this is one of the things that, I mean, you are known for. People travel to see you for this procedure.
Exactly.
Is that right?
I originally trained in this procedure in Brazil.
Okay.
I have done a number of studies as well. In fact, we've recently published an article in the Plastic and Reconstructive Surgery Journal where we've looked at over 2,000 results that myself and several other surgeons in Brazil and Mexico have performed. And so it's a very exciting field because it's a relatively new field, and we have access to lots of newer implants that weren't available on the market even 5 years ago.
You know, I asked you in my green room, and you said that even I couldn't tell. And if I had an implant, you can't feel sitting on it?
Not only can you not tell, but people that are with you won't be able to tell, even if they're actually
it's done right.
touching the buttocks
So it's
area.
not over the muscle, you said?
No, I typically place these implants within the muscle for that very reason. And we use a very soft silicone material that's really imperceptible. And the incision that we make is the incision within the gluteal cleft. So it's between the cheeks of the buttock. And a properly done gluteal augmentation procedure, that scar is virtually imperceptible.
Who's a candidate, by the way? Okay, because going into this, I told you, I didn't know that, I think of a certain demographic that would even do something like this. Are there mainstream people doing this?
Very mainstream people. I mean, people come from all different walks of life.
Like not just entertainers or young people that want to be discovered or look a certain way.
Randy, you know what's fascinating is when I first became interested in this topic, I decided to go to the source. In fact, we looked at Playboy Centerfold Playmates from 1953 until 2012 and looked at the waist-to-hip ratios, and we found that it's an incredibly well-preserved number regardless of what's something called body mass index. So regardless of the weight of the model, the waist-to-hip ratio is almost exactly 0.68, and we consider that to be the golden mean or the golden ratio.
Okay.
So in virtually all women, regardless of what height and weight they are, we try to recapitulate or recreate that waist-to-hip ratio of 0.68. And what we found is that when we do that, it gives a beautiful appearance to women at virtually any weight.
So better symmetry, they look
and better proportion. It gives you that hourglass figure that everyone talks about.
Okay, so let's then this procedure that you do, who's the typical patient that's coming in to see you?
I would say that our average patient is someone in their late 20s to their mid 30s. Although we've had patients at extremes, we've had patients in their early 20s, and I've also had patients in their 50s that want to look good in clothing and want it to be noticeable. And so these are typically people that feel unproportional. They either have been endowed with beautiful breasts if they're women, or they've had breast augmentation surgery, but they just feel that their buttocks is not quite proportional to the rest of their body.
They just don't have any volume in their buttocks?
They want curves.
Okay. And what do they say? I mean, what are their questions? So when they come to you, what do they want to know? What are the frequently asked questions, I guess?
Well, patients want to know, first of all, how long the recovery is, and it typically does take somewhere between 3 and 6 weeks for patients to really feel recovered enough that they can do most of the activities that they did before. So it's a little bit longer than some of the other procedures that we do in plastic surgery.
A lot of sitting, a lot of laying down?
Well, we don't let patients sit at all for the first 3 weeks. So they can walk, they can lie flat on their back, they can lay on their sides, they can lie on their tummy, but they just
just
can't
no
sit.
sitting.
Just
Okay.
no sitting, exactly, for 3 weeks. No dancing and those sorts of things as well.
All right. And so on your website, you have before and after photos?
We do.
People
We have
wanna
lots
know
of
more?
before and after photos of people that have tried to either be barely noticeable. Some people don't really want to have a very natural appearance, and also some people that want to have, let's call it a more of an enhanced appearance. Those are some of our patients that have been, say, playmates and centerfolds and women in modeling and actresses.
So are there a lot of people that you think are ideal candidates as a plastic surgeon that does this procedure you see on the street or wherever, and you say, boy, they'd be a great candidate?
Sure.
But there is a certain, I guess, things associated with somebody that would get this kind of a procedure. What are the fears and the hesitations the women have?
Well, because an implant is used, patients want to know if this is going to last forever, or if it's something like a
That's a
breast
good
implant.
question.
Right, or if it's something like a breast implant that might wear out that needs to be changed out, after a decade or so. And these are not gel-filled implants. In the United States, we don't use gel-filled implants. The FDA has approved soft, solid silicone implants, and so they don't necessarily wear out. It doesn't mean that they might not need to be changed out for whatever reason.
But they
down
can
the road.
last 20 years?
But they might last 30 years or 40 years or the lifetime of the patient.
Okay. And unlike breast tissue, you don't get the hardening?
Exactly. Capsular contracture is a very uncommon complication.
So it almost hasn't happened yet.
No. In fact, we've compared the complication rates associated with buttock augmentation surgery and breast augmentation surgery over the course of a decade. There are fewer complications associated with gluteal augmentation than there are with breast augmentation.
Okay. And but when you take is this really for the thinner person? I mean, ideally, to give somebody symmetry, is it for the thinner
Typically,
man,
yes.
thinner woman?
Typically, yes. And the reason for that is that a patient that has, say, more fat stores that we can use, let's say we're planning on doing liposuction anyways, I typically will use their own fat in order to restore volume to their buttocks. So it's for the thinner patient that doesn't have fat that can be used potentially for grafting purposes.
You know, I told you I wanted you to come on my show here in San Diego. We air all over the U.S. and all over Canada, but I wanted you to talk about Mommy Makeover, and you said routinely it's part of your Mommy Makeover.
Virtually a
Is that
routine
right?
procedure. Again, I'm trying to
I thought
recreate
this
that.
was a gimmicky thing, by the way.
Oh, not at all.
You know,
Not at
when
all.
I hear this,
Not at all. In fact, again, restoring that waist-hip ratio of 0.68 can be done in
so
virtually
this is the
any way.
golden proportion in a way of.
That proportion disappears typically after women have children because they wind up developing the muffin top and the fat stores that go in different areas that sort of straighten out the figure and give women fewer curves.
Okay,
And-
what
and
about
this
peeking
recreates
into the
that.
future, though? 60s, 70s. Now they're, losing their shape, their muscle, etc. This may look odd. How hard is it to remove?
Not at all. Not at all difficult. It's rare for a patient to want for those implants to be removed, but if for whatever reason that it needed to be, it's a very simple procedure.
What has been the satisfaction rate
incredibly high?
in your group of patients?
I
Like,
would
what do they
say-
tell you? What do they tell you?
Oh, well, first of all, patients love the fact that it's imperceptible to their partners, for example.
Really? So nobody would know.
No one would know.
You
No
can't
one
feel
would-
anything.
You can't. To the well-trained, obviously the well-trained professional, someone who does this for a living, I would be able to tell
Okay.
because I'm feeling for certain things. But most people typically wouldn't be able to identify that this particular person, by touch or appearance, had gluteal augmentation surgery with an implant.
How much art is involved or science? You probably feel like you have an eye for this because people are doing this across the country. How much art is in this?
You know, Randy,
Technique.
what's important to know is that the implant needs to sit in a position where it provides maximal projection where that person wants it. And so placing implants high is important so that it gives more of the appearance of a shelf sort of in the back area, and that it's not too low, which gives the appearance of, say, a heavier bottom, for example. So that's an important thing. Also, knowing which plane to place the implant is important. I think placing it within the muscle is incredibly important. The thing is, I shape these implants. These are
Really?
customized implants in a lot of different ways.
Is that right?
So that every patient doesn't get the same implant. It's not an off-the-shelf implant in most cases. I'm contouring these implants in the operating room.
So they just like with breast implants. I mean, they vary in size. These vary in size. So you could give a very subtle difference.
Exactly. And
If
again,
that-
I can actually, these are solid silicone implants. I can shape these these implants in the operating room.
Because you don't want to, going into this, and I think, okay, but buttocks augmentation. What do you call it again? You call it
Gluteal augmentation.
okay, gluteal augmentation. I think of people like Snooki. Like this is the demographic that would want to get this. But
You'd be
you're
surprised,
saying
Randy.
regular people.
Randy, you'd be surprised.
So I probably know somebody that has
you could very well.
gluteal augmentation. So more and more men are doing this? And what is the ratio? Is it
I would
more,
say it's
more?
probably nine women for every one male.
Okay. And it doesn't feel odd to them sitting on them?
You're not actually sitting on the implant itself. And that's
Because it sits up higher.
It sits up higher, exactly. It's in the gluteus muscle that sits up higher. So it's actually behind you when you're sitting.
For some people, now look, as a plastic surgeon, people confide in you on the consult. Are there people that really their self-esteem is bothered because of their buttocks?
No, absolutely. And typically patients will tell me, especially male patients, for example, that they, even when they wear a belt, their pants fall down because they have nothing to hold up their pants. And implants help with that. And then in women, for example, they want to look great in a dress when they go out at night. They want to have a noticeable curve in their bottom.
Interesting. Okay. Well, look, I want to thank you for coming on the show. Final message, though, to somebody that's considering this. And by the way, is there any misinformation about this procedure that you hear on the street that drives you crazy?
The greatest misinformation, I think, is that this is somehow a dangerous procedure which is fraught with complications and has a high complication rate. And the reality is, now that we've done that study, that we know that this is a safe and effective procedure that can be safely performed by people who know what they're doing and has a lower complication rate than something that everyone knows has very high satisfaction.
So it's in the muscle.
Like breast surgery.
It's not under the muscle. You can't put it under the muscle.
It's within the muscle.
So within the muscle. Is there a percentage of doctors, plastic surgeons across the country that are doing it over the muscle?
There are. And
like 20%, 30% over the muscle?
It's almost evenly split, but it's about 60-40.
Really?
60% place them intramuscular. You can place larger implants on top of the muscle.
Is it harder for you, more technically demanding
Much.
for you as a surgeon to put it in the muscle?
Absolutely. It's a much more technically demanding procedure to place it exactly within the muscle.
So you
sandwich.
just will not do over the muscle?
I typically will not.
You won't. And why? So somebody watching this, considering this, whether it's on YouTube or on TV or whatever, what do you want them to know about over the muscle? Why it's not a good idea?
Well, because they can displace over time, they can become more palpable over time, meaning that people can feel
They
them.
can move around.
They can move around. You might be able to feel them over time if the soft tissue is thin, if someone loses weight, for example. And there are other associated complications that can occur with implants that are on top of the muscle as well. Patients can get fluid collections, for example. It's more common to get a fluid collection on top of the muscle.
Okay, so you like the procedure.
I love the procedure.
Good for you. Well, thank you for coming on the show.
Thank you.
Very interesting. So they could go to your website, find out more. We'll have your website at the bottom of the screen. Pleasure to have you on the show. We'll have to have you back talking about Mommy Makeover. Thanks
Look forward
again.
to it. Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.